evening. Welcome to APTN National News. I'm Melissa Ridgen. Controversial Senator Lynn Beyak is leaving the Senate. In a statement put out this morning, she said today is her last day. Beyak landed in hot water when she said good deeds also happened at residential schools. Her comments ignited controversy. Beyak also posted and refused to remove offensive letters on her website. That led to her suspension from the Senate in May 2019. In today's statement, Beyak stood by her comments that there was good as well as bad at the schools and said her support of 8-year term limits for senators was why she resigned today, her 8th anniversary. An investigation into how an Ojibway woman died while in care in an Alberta hospital over the holidays is underway. Family of the woman from Sandy Bay First Nation say they question her treatment while in hospital. Tamara Pimentel has this report on what happened and a warning recordings of the incident may be triggering.
In the hours leading up to her death, 40-year-old Lillian Ashley lays in a hospital bed with difficulty breathing. Her husband, Corey Ashley, is beside her and took this cell phone video after he says he begged hospital staff in Hanna, Alberta to give her oxygen.
She wanted to live. She deserves to be alive. And this is what I have of my wife.
Now, as he picks up his wife's ashes 200 kilometers away in Calgary, Corey questions her treatment at the Hanna Hospital and why Lillian, a well-respected Ojibway woman, died December 26, 2020 while in care.
Everybody that knew her was glad they knew her because she touched them some way, somehow. 2015, we lived in Kamloops, started making food, collecting clothes, and we were bringing them to the homeless. My wife gave to everybody.
It was Christmas morning in their home in Hanna when Corey realized something was wrong.
I could see my wife's face was just beet red. She had sweat dripping down her face. I walked up, I put my hand on her head with the back, and she was burning up. And what's wrong? And she goes, I can't breathe. She goes, it hurts, something's wrong. And I knew right then there was something. I dialed 911 instantly.
According to a medical record that Corey provided, when paramedics arrived, Lillian was sweating heavily, was pale, and her right lung sounded decreased. She was then taken to emergency.
And that's where my wife is on a bed. No oxygen, no nothing on her. She's just laying there trying to breathe. I went right up to my wife and I put my arm on her. Are you okay, dude? She goes, I can't breathe. I need help breathing. I can't breathe. I need air. And she was shaking. She was scared. And now she was cold instead of hot.
After an electrocardiogram, an X-ray of her lungs, and COVID swab, the X-ray came back clear and COVID had been ruled out. Corey says he then requested many times for his wife to be given oxygen, and that she had been in hospital for almost 2 hours without oxygen. Frustrated, he began to record. In this video, nurses can be heard telling Corey that the hospital computers are down and test results are needed before any further treatment is given, as well as comments about Lillian's use of methadone, a pain medication prescribed by her family doctor to treat abdominal pain.
She's admitted to taking too much methadone, and she hasn't had any since yesterday morning.
Corey says his wife did take too much methadone. She finished her prescription 3 days earlier than she was supposed to, 1 day before arriving here in the emergency room.
That's not why she's here. She can't breathe.
The medical record shows there is no mention of oxygen, but under the diagnosis section, methadone withdrawal and cardiorespiratory arrest are written. APTN spoke with a doctor who was unable to comment about this specific situation, but was able to give us some general background information. The doctor said when a patient arrives in an emergency room with difficulty breathing, oxygen is often provided. The doctor also said that the use of painkillers like methadone is not a reason to withhold oxygen.
All she could say was, I'm really scared, and it was so faint. I knew she wasn't doing well, and they wouldn't believe me.
After confrontation with hospital security, RCMP were called and Corey was asked to leave. The medical records show that Lillian had then been giving breathing exercises. While in the hospital parking lot, Corey continued recording. An RCMP officer is heard relaying information from Lillian's doctor.
So the doctor tell me that they've checked all of her vitals and everything's looking pretty normal, but they are going to keep her for observation for the night, okay?
It was later that night when the doctor called.
And she goes, "Is this Corey Ashley?" I went, "Yes." She goes, "Corey, you have to get here. Your wife stopped breathing." I said, "Is she okay?" And she says, "No, she's not."
He says when he arrived back at the hospital, he saw Lillian undergoing chest compressions.
Because I looked and my wife's body was dead. There was nothing there. I could see it. I heard a nurse say she's had no pulse for 45 minutes since we found her. I put my hand under the blanket as I'm calling out her name, and I put my hand on my wife's leg, and it was cold.
In a phone call, a medical examiner investigator told Corey that Lillian died with wet lung, a condition resulting in the lung's inability to receive enough oxygen. The cause of death is unknown, and it could take up to 6 to 12 months to determine. An email from Alberta Health Services states, "We are unable to discuss specific details of this case due to patient confidentiality and privacy." It said an investigation into the incident is being done. Meanwhile, Corey says he is seeking justice for his wife and has filed a complaint to the Alberta College of Physicians and Surgeons.
My wife, just like every other person on this earth, has the right to breathe.
Tamara Pimentel, APTN National News, Calgary.
Slowly but surely, flowers and memorial notes are being laid at a site in Montreal. It's where Raphael Napa Andre was found dead last weekend. Andre was an Innu Naskapi man, originally from Matimekush, Lac Saint-Jean in northern Quebec. His body was found in this portable toilet last week. Through APTN, his family asked people to lay blue flowers in his memory as they started popping up at the site over the weekend, along with notes stating that he will be missed. Adequate housing for the homeless Indigenous population is a countrywide issue, including the story we just heard. Frontline workers in Ontario have released a status report on homelessness around North Bay, Ontario. It makes 4 main recommendations to improve resources, and quality of life on the ground. Joining us now to break that down is Kathy Fortin, Executive Director of the North Bay Indigenous Friendship Centre. Kathy, thanks so much for joining us today. So first of all, what's your reaction to the fact that a homeless Indigenous person, somebody like Raphael Andre, literally dying outside due to a lack of housing?
Well, devastating, obviously, and it has to do with the overcrowding of shelters right now due to the weather, and the lack of supportive housing and cultural relevant trauma-informed services. Sadly, I believe there'll be more people caught up in this critical event that occurred.
Can you paint us a portrait of what specifically is happening in North Bay? I mean, we see homelessness is an issue throughout the country, but specific to North Bay, what's going on there?
So in North Bay, we had a point-in-time count conducted by our local District of Nipissing Social Service Board. Indigenous people account for 14% of the city's population, but account for 42% that are homeless within North Bay. The NBIFC currently has 2 Suswin homeless navigators that help Indigenous people navigate their way through the system in regards to housing.
Part of the report, you've got a four-part plan that's based on the study that you guys have done of the homeless population in North Bay with municipal governments, mainstream organizations. Do you feel that there's a willingness to cooperate on the 4 points that need to happen?
Well, people experiencing homelessness endure all kinds of stereotypes, most which rely on the assumption that their situation is somehow their fault. We have to change how people view the homelessness They are someone's sons, daughters, moms, dads, and they are deserving as anyone else to have a safe place to sleep and a chance for a future.
Is the federal government doing enough to ensure adequate housing for First Nations people, whether they're on reserve or in urban centers?
So there is systemic underfunding of adequate housing for urban Indigenous people living in the cities and towns across Ontario from both provincial and federal levels of government.
North Bay Indigenous Friendship Centre is suggesting the creation of transitional housing. Can you tell us a little bit about the Seswin Village project? How would it help bridge service gaps?
So currently right now, the Friendship Centre is in the process of creating a 30-bed transitional housing located right across from the Friendship Centre. It's going to have wraparound service with cultural appropriate programming. I believe that this will fill the many gaps, especially when it comes to cultural sensitivity and cultural awareness amongst non-Indigenous people.
Well, good luck with that. I hope that this is something you guys can get sorted out a little bit faster than we see it happening in some communities, and nobody else has to die frozen out on the streets. We need to take a break, but still ahead, a doctor answers your questions about the COVID-19 vaccine. Stay with us. Welcome back. Canada will not be receiving its allotted doses of the Pfizer vaccine this week due to production delays. Minister of Public Services and Procurement Anita Anand said that this delay is just temporary and does not affect the government's overall plan.
Soon as possible. With more than 1.1 million vaccines distributed across this country to date, we are on track to have 3 million Canadians vaccinated by the end of March, and all Canadians who wish to be vaccinated will have access to a vaccine before the end of September 2021. Mr. Speaker, we are on track with our strategy. This is a temporary interruption, and we will make sure we deliver for Canadians because nothing is more important.
Nunavut had gone nearly a month without a new case of COVID-19. Then late last week, one case was discovered, and as of today, there are 17 active cases of COVID-19 in Nunavut, all in one community, Arviat. While most Nunavut residents have been supportive as Arviat heads into a second stretch of lockdowns, some online have been critical of the residents, blaming and shaming them for spreading COVID. Nunavut's head doctor points out those comments aren't just hurtful, they're actually damaging to public health overall.
To be honest, taking a punitive approach is counterproductive, because what it encourages is people not coming forward, people not participating with testing and tracing, and that increases the risk of hidden transmission and increases the danger of it spreading further than we realize.
The number of First Nations people with COVID continues to cause concern in Alberta. And as we've been doing each Monday of this new year, we have questions about the COVID-19 vaccine answered by a doctor. Joining me now is Dr. Chris Sarin, Deputy Medical Officer of Health in Alberta. Thanks so much for joining us. So what is the situation in Alberta right now with regards to COVID case numbers and the vaccine rollout?
Well, we're still continuing in Alberta, like the rest of the prairie provinces, to see a high number of active cases. We have over 1,100 active cases in about 37 First Nations, so that's on reserve in Alberta, and that's close to our peak. We watched the numbers very, very closely, and it looks like a small decline from last week. Unfortunately, we also know that we have 68 on reserve First Nations currently in hospital in Alberta, which is a very high number.
Do you guys know what is the cause for the sudden spike? Is it just that people were getting a little bit more relaxed doing the gatherings? Is there a theory as to what caused the spike?
Yeah, we have lots of theories. We have a lot of variety in the First Nations in Alberta. Some nations are very close and border on the big cities like Calgary and Edmonton. We know there's a lot of back and forth. And up until maybe 3 or 4 weeks ago, Alberta had almost the highest case rate in the country for a couple months. So the population prevalence offers are very, very high. We know that that's come down since the enhanced approaches put in by Alberta Health in mid-December. And so I do believe that we've had a situation post-Christmas and New Year's. There have been some gatherings. And in certain communities, we do see pandemic fatigue that you see off reserve. But the big factor, I think, is First Nations are reliant on their nearby cities and towns. They move back and forth. And even though there's a lot of restrictions in place, occasionally things get through and then you see a local spike in a community.
Yeah. We have a few questions from viewers that they wanted to ask you. Shannon wants to know, when should recovered cases think about getting the vaccine?
Yeah, that's a very good question. And in a time of vaccine shortage, we very recently said, you could consider deferring it a little bit. Now, each community in Alberta and across the country is actually going to have their sort of separate individual COVID-19 vaccination plan supported by Indigenous Services Canada, who I work for, also supported by Alberta Health Services and Alberta Health in Alberta. So a real big team approach, but each community is only going to get a smallish allocation, and they're going to have to decide if they prioritize those that have not recently had COVID infection, and it'll be different in each community. In a community where they've had very limited COVID-19 disease and only 1 or 2 people have had the infection, if your number comes up, I suggest you go ahead and get the vaccine. But some communities with a lot of cases are going to have to really treat this vaccine like the gold that it is, and maybe try and give it to someone else because the person who recently had disease does have some relative protection.
Yeah. Somebody else asked, Starla asked, what are the recent side effects that are caused by the Moderna vaccine? And why, then the second part of the question was, why isn't the government making sure that everybody's aware of potential side effects beforehand?
Yeah, well, we're doing our best to communicate it out. There's no secrets. And as your listener likely knows, the initial vaccine trials were held in a large number of people, tens of thousands of people, but not millions of people. And so as the vaccine gets rolled out, we see certain signals, and most recently, and we do change the communication. So any vaccine has side effects. Every vaccine has side effects. Fortunately, the Moderna and the Pfizer vaccines are well known, and the only recent change that I'm aware of is a slightly higher risk of that very severe reaction called anaphylaxis. So we think of it as 1 in a million for most vaccines, but it is higher in certain vaccines. And for this one, we didn't see a lot in the initial trials, and now some evidence out of the States, it's likely 2.5 per million. So still very, very low. But anybody who gets a vaccine needs to be aware of the risk of anaphylaxis. And that's why we have processes, why we watch people after you get the vaccine. And if that becomes 3 or goes down to 2, it's still a very, very small number. The side effects we know about are common, and I call them basically nuisance side effects. You do get a sore arm, you do get some swelling and redness in a small portion of people, very manageable. Some people do feel a little bit unwell, very manageable. And so these are expected side effects. And we're watching really closely for those rare 1 in a millions. And so far, just anaphylaxis is looking a little bit higher.
Dr. Saran, thanks so much for joining us today. It's always nice to talk to the doctors and ask questions and get some answers for us. So thanks for doing that for us.
You're welcome.
Time for another break, but when we come back, we remember legendary Toronto Maple Leafs captain George Armstrong. Stay with us. Welcome back. It's time now for our photo of the day. Today's photo comes to us from Monica Buchanan, and this amazing shot from the lands of the Nadle Wuten First Nation located in the heart of British Columbia. We want to thank to all of our viewers who have been sending us these great photos. You can send us one too. Email it to share@aptn.ca, and don't forget to say where it was taken. Now let's take a look at tomorrow's weather forecast. To the east coast, we got 0 and some flurries for St. John's, 1 and sunshine for Fredericton. Inukjuak, mix of sun and cloud, -13 degrees. Kuujjuaq, snow, -9. Quebec City, -9 and sunshine, same with Montreal. Toronto, -1 and snow. North Bay, -7, mostly sunny. Kapuskasey, mix of sun and clouds, -13 degrees, sunshine, and -20 for Big Trout Lake. Puckatawaga, -25 and snow, -25 and sunshine for the Paw. -25 and sunny too for Winnipeg and Brandon. -25 and sunny for Saskatoon, -19 and sunshine for Regina. -26 and sunny for La Ronge, -30 and sunshine for Stony Rapids. Snow, -19 for Fort Chip and Fort McMurray. Edmonton, -15 and snow, sunshine, -9 for Lethbridge. Kamloops, -1 and snow, Bella Coola, 0 and sunny skies. Sunshine and 1 for Prince Rupert, -17 and snow for Fort Nelson. Whitehorse, -18 and sunny, -29 for Mayo and Dawson City and sunshine. -25 and snow for Wati and Wrigley, -28 and snow for Norman Wells. Paulatuck clear, -25 degrees, -29 and snow for Colville Lake. -17 and snow for Baker Lake. Nuyat, -15 and clear skies. -17 and clear for Igloolik. Talioke, -21 and snow. Kenai, -17 and sunny. Legendary Toronto Maple Leaf captain George Armstrong died yesterday at the age of 90. Armstrong was among one of the first Indigenous players to play in the NHL, and he is the first Indigenous player to score a goal in the league. Armstrong was nicknamed the Chief by the Stoney Reserve in Alberta during a visit in his early playing days. He played over 1,100 games for the Leafs and captained them for 12 years. He won 4 Stanley Cups and was ranked number 12 on the 100 greatest Leafs of all time. Armstrong was inducted into the Hockey Hall of Fame in 1975. His granddaughter Kaylee says George was proud to be one of the first Indigenous people to play in the NHL.
We're very proud of him, and he was so proud to be Indigenous and kind of be one of the first people of Indigenous descent to play in the NHL. And I think he's impacted so many people, and we're kind of the past few days have just been crazy. We're just realizing how many people just absolutely adored him, and it's been obviously tough, but it's been so nice to hear so many people tell us how awesome he was.
Our thoughts are with his family, of course. Well, that's a wrap on the news to kick off the week. I'm Melissa Ridgen. Thanks for joining me. I will leave you with this from the Brandon, Manitoba Bear Clan, who finished a night patrol with a little Red River jig in the parking lot. Have a great night.